Greetings from the World Health Organization. My name is Tarun. I head the Brain Health Unit, and it is my pleasure to present the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders. It will be preaching to the converted if I talk about the burden that we see due to neurological disorders, but there are a few points I wanted to make today. One, we are aware of the global burden of disease data and the currency that it uses, disability-adjusted life years. And if we look at the DALYs, the leading cause of DALYs is neurological disorders. If we look at death, neurological disorders are the second leading cause of death, 9 million deaths per year. 1 in 3 people worldwide have a neurological disorder at some point in their lifetime. What is very important to remember, the huge burden that we see in low and middle income countries. 78.5% of deaths and 77.3% of DALYs due to neurological conditions are in low and middle income countries. So the chart on the right, it tells us about the different conditions, and globally across almost all the region, the 5 top causes of neurological DALYs are stroke, migraine, Alzheimer's disease and other dementia, meningitis, epilepsy. Now, one thing we should remember is that it doesn't cover some of the rare conditions, but when we think in terms of the approaches to diagnosis, to treatment, and to care, the strategies are very much similar, and I'm going to talk a little bit about them as I go through the action plan. So I presented about the burden that we see in low and middle income countries. What we should remember, and the thing that needs to be addressed, is the high treatment gap that we see in these countries. So for example, 1 in 10 people with dementia receive a diagnosis in low and middle income countries. Only 1 in 4 people with epilepsy receive treatment. There's shortage of drugs, a non-availability of medication. So for example, 1 in 3 countries have levodopa carbidopa, and I'm talking about basic essential medicines here that are available at primary health care. The workforce is very limited. So if there are 7 per 100,000 neurological workforce in high-income countries, it is only 1 per million in low-income countries. And if we start thinking in terms of the specialists and the subspecialties, they are even more limited. And so if you think in terms of these limitations, they hold true for condition like a multiple system atrophy. So you have lack of specialists, you have lack of rehabilitation units, you have lack of occupational therapists, speech therapists. The Intersectoral Global Action Plan on Neurological Conditions that was adopted by all countries in the World Health Assembly in May 2022 sets to address some of the challenges that I talked about. The vision of the action plan is a world in which brain health is valued, promoted, and protected across the life course. Neurological disorders are prevented, diagnosed, and treated, and premature mortality and morbidity are avoided. And people affected by these conditions and their carers attain the highest possible level of health with equal rights, opportunities, respect, and autonomy. The goal of the action plan is to reduce the stigma, impact, and burden due to neurological conditions and to improve the quality of life, not only for people with neurological conditions, but also their carers and families. So to attain this aspirational vision and goal, the action plan has 6 guiding principles. The first is people-centered primary health care and universal health coverage. And thus it means that it is for all conditions, including rare conditions. An integrated approach across the life course, evidence-informed policy and practice, intersectoral action. So it is not only health sector, but also social sector, employment, education. All of these sectors have a role to play. A guiding principle that is very important and very close to my heart is about empowerment and involvement of persons with neurological disorders and their carers in all the policies, service delivery that we talk about, and gender, equity, and human rights. So the way that the action plan is organized is that there are 5 strategic objectives: prioritization and governance, diagnosis, treatment, and care, promotion and prevention, research, innovation, and information systems. And there's one on specific on epilepsy. And I am going to talk about in detail about each of these strategic objectives. Then it has 10 global targets that are linked to each of these strategic objectives, and comes with proposed action for member states, WHO, and international and national partners, and that includes many of you. So let me walk through each of the 5 strategic objectives. You can find all the information on our website, but this is just a brief overview of each of these objectives. So the first one is about raising the prioritization and strengthening governance. So it includes advocacy, about awareness raising, advocating for understanding, decreasing stigma, policies, plans, and legislation that are promotive, that are protective, that includes these neurological disorders, and funding and financing that is needed. And so you can, if we look from the angle of MSA, one can realize that how each of these areas, action areas, are relevant for MSA. The second strategic objective is about providing effective, timely, and responsive diagnosis, treatment, and care. The first action areas are around care pathways. So it is about primary care, community-based care, strengthening both emergency and chronic care, rehabilitation, so that there is continuity of care, self-care, medicines, diagnostics, and health products, capacity building of health workforce, and support for carers. Now, if we look from the angle of any condition, including rare neurological conditions, all of these action areas, they hold true. The third strategic objective is about promotion and prevention. And this takes a life course approach. And this includes healthy behaviors, control of infectious diseases, preventing head spinal trauma, reducing environmental risks, and promoting optimal brain development. And this one is specific for children and adolescents. The one that is very relevant for MSA community is the strategic objective 4, to foster research and innovation and strengthen information systems. And this is about better research, coordinated research, including low and middle income countries, engagement and consultation with end users, and having capacity of knowledge exchange, data and information systems. And I don't need to tell the importance of data that we need if we have to better manage patients, better manage services, better manage policies. As I mentioned earlier, there is specific strategic objective on epilepsy because that was the starting point for the action plan, and it includes about access to services, engagement and support for people with epilepsy, and epilepsy as an entry point for other neurological disorders. And this is where we come in as WHO. And I'm going to talk a little bit about the work we do at World Health Organization. And as I mentioned, I head the Brain Health Unit. It is in the Department of Mental Health and Substance Use. And it's a very small and lean and thin team that we have, but a lot that is happening, a lot that is needed to promote brain development, to prevent neurological disorders, and to provide better management and care. And all of this cannot be done by one person or the team that you see here, but it requires partnerships and collaboration. And that is the purpose of this presentation today from our side. We are about taking an integrated approach, simply because if I go through the conditions and, if you look at the ICD-11, there are many, many conditions. And so if we start working on each of those conditions, we can't really make a difference. We have to take an integrated approach. And then we have to think of conditions over a continuum of care pathways. So importance of promotion and prevention, diagnosis, treatment, rehabilitation, and palliative care. We need to think in terms of how do we get integrated within of the different systems and take a life course approach. And universal health coverage, primary health care are very important as we think about this integrated approach. We have published a framework as well as definition for optimizing brain health across the life course. And I think this is very relevant because it is about how do we address brain health determinants at individual and society level. And so these are healthy environments, safety and security, learning and social connection, access to quality services, and physical health to have optimized brain structure and function across the life course. And this is required for enhanced well-being, improved health, and social and economic benefits. So this is our position paper, again available on our website if you are interested in brain health. A little bit about the other things that we work on. And as I said, within our unit, we take a life course approach. I mentioned about the action plan on epilepsy and other neurological disorders. Our unit is also responsible for coordinating implementation of another action plan that is on dementia. So that's a very specific mandate that we have. But there are lots of other areas that we work on. And I'm not going to bore you or provide you, go through everything that we do. But just a little bit in terms of the message that I wanted to provide is that for country level implementation, we have various tools, guidance, blueprints that are available, and that can help in implementation of this intersectoral global action plan. So for example, like on Parkinson's disease, we have published a technical brief. So it takes the approach from not taking a clinical approach, but more a public health approach on conditions like Parkinson's disease. And that's what we focus on, that how do we take that integrated public health approach to many of these health conditions. This is my last slide and a little bit of where we want to take forward. I mentioned about the partnerships, and I think that's extremely important. What you see on the right is, in fact, a forum we have with people living with dementia. And that's a collaboration, but also not only with people with lived experience, partnerships with civil society, NGOs, professional societies. That's key for making many of these things happen. Leadership and advocacy. Neurological disorders have long been not prioritized. We don't have investments. We don't have policy dialogue around those issues, and lots needs to be done. There are quite a few guidelines, guidance, technical products that are available from WHO. What it requires is the partnerships and collaborations to make it happen and work at country level. And all of this requires a good monitoring system. We are coming out with a global status report on neurology next year, and that we will be using regularly to monitor how things are doing. So with this, I end my presentation, and thank you for your attention and giving me the opportunity to talk to you today. Thank you very much.